Okay, let's talk about this trauma training and my commitment to you and your commitment to me. Okay, so my commitment to you is to provide you with skills, with knowledge, to deepen your understanding of what it is to be a trauma informed professional, deepen your understanding of what trauma is, and ways to more comprehensively connect your clients who have trauma symptoms to more confidently engage with your clients in a therapeutic process from the very first phone call when they reach out to you, because we know that trauma healing starts from the very first interaction, right? I know for myself, there have been clients that just from the conversation they had with me on the phone, I already just connected with them and gave them a sense of hope and possibility, but also helped them realize that this is not a quick fix, but I'm going to do my very best to help them. And so my commitment is to help to give you those tools, the hard tools of trauma-informed healing, as well as the soft interpersonal tools and tools along the way, okay? My commitment is that I will also be here to support you as your instructor, as a trauma specialist, and as someone who wants to develop a relationship with you as a professional in this format. I want to get to know you. I want to get to hear about your strengths. I want to get to hear about the areas of your struggle. And I want to get to really support your process so you could maximize this training experience, okay? Now, obviously, there's a framework of this group setting where we have, the sections where you're watching videos, and there's segments where we're having more of the live consultation. The way that you are committing to this course and your commitment from your end to me and to this commitment that you've made to yourself is to prioritize this training. You signed up, you decided to invest time, energy, money, and effort into coming to this course. So what's important is that you prioritize time so that you can actually take the time to learn, to read, and to digest the information that we have on here. I encourage you to take 1 hour a week to watch the videos, to read the information, and to really reflect on what you're learning about yourself, your personal life, and about yourself as a professional. Maybe even to think about clients that you're incorporating some of the skills on. We also have a case consultation form where we talk about, right, those cases in our group consultation. And I encourage you to really utilize that format, because you're going to get the most out of this training if you are intentional and mindful about, really digesting the knowledge, sharing, and getting feedback and support from myself and from the people in this cohort. Okay? I encourage you to show up, to be present, to make sure that you are well rested and that you are being mindful in how you're receiving the information. I also want you to be mindful about what your expectations are of this course, right? I've done trainings where I hope to get 17 million questions answered, and then I realized, okay, well, that's not realistic. But the best thing that I can do is to feel more clear on the question, to take off a pressure that I have about, offering something in a single session, or maybe to just reframe or restructure where I was at in therapy with a client, or in something that I needed in my own personal life, or to shift a certain unspoken agreement or a boundary. And so what I can let you know, my commitment here is to help you, feel more comfortable in your skin as being a trauma therapist, to knowing where you're at. You might realize that, there's more learning to do, or maybe there's an area that you're already working on yourself. And staying the course of, the work that you're doing as a person, as a professional, being steady. We know that with good trauma work, the quickest way to go is slow. And so I had a time where I had like piles of trauma-informed books at my bedside, and that wasn't the best time because I was going to sleep too late and then I wasn't taking good care of myself. So really finding a balance of, you're in this course, there's a lot of information. I don't want you to be overwhelmed. I want this to be a parallel process. Just like sometimes clients can come in a panic, in a huff, I want to be healed yesterday. Part of your work in this training is that we're not going to force knowledge and information into your mind and your body and your energy. We're going to practice it. I want you to try interventions on for size. I want you to try exercises. You're going to see that the formats, there's a reading section, there's a video section, and then there's exercises. And I want you to share the exercises. Submit how it is when you try it, okay? Because I want you to really embody and personify the skills. I know that from trainings that I've done where I got to practice skills or really self-reflect, when I came into session, the next session, my clients felt a shift. And it's not because I said to them, hey, I'm in this very immersive training, right? And it's up to you if you want to share, but they felt that I was embodying certain things, or I felt comfortable saying, hey, could we try this today? Or I was just actually in a training, or I was actually reading something and I thought that this might be useful. Can we try this? And there's a confidence and a flexibility because you're really embodying the knowledge and the information, okay? So what I can tell you is that the most important thing for me, for you to get out of this training is wherever you're at, that you experience a widening of your bandwidth, that you have more capacity to understand, to relate to, and to understand your role. So you're not trying to fill 15 million roles, but you're also not being neglectful in your commitment to your client. To get clarity about the goals that you have, and to have more of a bandwidth of understanding who's in the room and your commitment to your client, right? The parallel process is, here's me and I have a commitment to you, so I'm teaching you and I'm getting to understand you, and then you're taking knowledge and information and better understand your client and providing them. Okay, so we're engaging in a parallel process. And for me, just so you know, I have processes going on. I have experts and consultants that I consult with, right? So I get my consultation. I'm here to support you, and then you support your clients. And then obviously your clients are loving on themselves and also seeing how they can tend to, their own lives or their own dreams, right? If they're avoidant or if they have certain behaviors that need help. So there's a lot of the parallel process happening because when we avoid ourselves, then, we can't tend to whatever we're needing. So, right, my goal is for you to widen your bandwidth, to expand your toolkit, to really have more sense of confidence. So many times clients ask me, like, what's the skill, or where did you learn that, or with this feeling that you have, and it's not like a skill. A lot of times, like, what's happened is that as I've invested in good consultation, or as I've invested or took the time and the energy to engage in my own therapy, and then also to connect with really smart and, connective and compassionate, skilled practitioners in the field, my confidence grew. So you're investing in yourself, and that really conveys as you solidify your confidence and your clarity, okay? What's also really important is that I want you to improve your clinical outcomes. So at the end of the day, the more clarity you have, the better you will be at helping your clients improve their clinical outcomes. Now, that doesn't mean that you're going to help your clients heal 1, 2, 3, right? Healing is not like that. Therapy is not like that, and especially trauma therapy. But if you are clearer, or when you're clearer about what your goals are and how you're tracking progress, and, understanding when there's a shift, or understanding when there's like a crisis that came up, and naming that more clearly for your clients, then you're going to be able to track when there is a shift, even if it's a very small one. And so you're going to be hitting your clinical goals, and you're going to be tracking your outcomes. And I'm going to teach you how to do that, okay? Now, one of the things that's really important for me as well, and my offer here, is that you are joining a community of trauma therapists. I intend on creating a platform where everyone who has taken this training so far, and future people who will be taking the training will be able to interact with each other. Because one of the most powerful things is, in addition to learning from myself or learning from, other specialists and experts in the field, one of the biggest gifts that you can give yourself is connecting with other like-minded people. And so you are joining a community of fellow trauma-informed therapists, specialists, and so you could continue, cross-reference, support each other, people in different places, and really just normalize the experience of being in this field because it's a unique kind of experience, okay? What I do have to say is that, one of the most important things to keep in mind is that whatever you are learning in this training is take with a grain of salt. I know I've gone to trainings where I'm like, well, this really resonated and this really didn't. So anytime you hear information, take what's helpful and then drop the rest. I've, taken skills, training from consultation, from wherever. And it's the same thing with your work with clients, right? Even in therapy, where it might be like, let's try this intervention. If it doesn't land, drop it and we'll try something else. Or let's just notice what about that didn't resonate, so I could try again, or I could just see what didn't land. So just whenever there's an information or a suggestion, like I'm so receptive to feedback, I want to hear. But also if there's a tool that doesn't resonate, you can tweak it as long as obviously it's ethically competent. But really just personalize this to yourself. You have a zone of genius. You have areas of expertise or your own unique strengths and your own story, personally and professionally. So really just take what's helpful and really lean into your own clinical voice. And the last thing is that anything that's shared in this training, in the live training, it really stays here. So, we're protective over client confidentiality. Obviously, when you share client cases, share information that protects clients' information, but also anyone in the training, we don't share outside of the training. And any of the information, like you've signed in the format on the agreement for the trauma training, you don't share any of the knowledge, intellectual property that stays here. Of course, if there's worksheets that are helpful for clients, those are meant to be shared, but the knowledge and information is meant just for you and for those of you who are taking the training. So just keep in mind that this is a learning process for all of us. We are learning together. I'm excited to be journeying with you as you evolve and you grow. And in the next video, we're going to talk about the best ways to maximize this training experience and how to navigate.